Secrets of Penile Enhancement Exposed. Dr. Conrad, I want to make my organ longer. Do it somehow, please. You know, this is a problem I hear about constantly. Many people come to me for this treatment. Last week, I released a video talking about normal organ size, and it was based on a large journal meta-analysis. Here's what surprised most people. Out of 10,000 men, only about 1.5, fewer than 2 men, actually have a small organ. Let me be clear about this. If your erect organ is less than 3.2 inches, then yes, it is considered a medical problem. Otherwise, it's not. But here's the thing. Many men, especially around 40 years of age, think their organ is small. And that mental concern? That needs to be addressed first. But still, let's say someone really wants enlargement. What's true and what's complete nonsense? There's a whole industry out there selling all kinds of products. Today, I'm going to scientifically explain everything to you. No BS, just facts. I'm Dr. Conrad, a reproductive medicine specialist, and at the end of this, I'll tell you exactly what I explain to my patients. Plus, I've got a bonus tip for you, so stick around. Look, honestly, the greatest joy in life comes when you have a baby or when you're truly happy. I'm a uroandrologist, and yes, I perform surgeries. But here's what most people don't know. Very few people actually need this surgery, and it has its own serious problems, which you absolutely must understand. Most importantly, many websites are selling products that can actually cause harm, real harm. So please beware. Keep watching because this video is going to be very, very informative. Enhancement techniques that might actually help. Okay, let's start with some lifestyle changes that can genuinely help. First, reduce your weight. If you're overweight, your organ may look smaller even if it's completely normal. Why? Because fat, especially below the abdomen, literally covers part of it. When do you lose weight and reduce pelvic fat? It helps a lot. Plus, it makes intercourse more comfortable too. Second, exercise and improve your muscular development. Get into shape. Once you do, your overall posture changes, your visual appearance changes, and you'll realize it wasn't as small as you thought. Seriously. Third, groom your pubic area. When hair is trimmed properly, your organ won't look buried or hidden. It's a small thing, but trust me, it's very effective. Now, let's talk about the many unproven techniques that are sold everywhere. I'm going to explain them one by one, so pay attention. Organ exercises, the Jelqing myth. First up, organ exercises. Some people claim that exercises like Jelqing can increase size. Do you know what Jelqing is? It involves pulling the organ from base to tip using your fingers for about 20 minutes a day. So does it work? No, absolutely not. In some people, it actually causes microtears, scarring, and even fibrosis. It doesn't help. It can hurt you. Tablets and supplements. Save your money. Next, people constantly ask me about tablets or supplements, just like they ask for pills to gain weight, lose weight, or grow hair. They ask for pills to increase organ size. Let me be very clear here. No supplement increases organ size. None. Now, some products contain Viagra, which can improve your erections, but it does not increase length. Other supplements like L-citrulline or arginine, they increase nitric oxide and improve erection quality. But again, they do not increase length. Penile traction devices, limited use only. Next is penile traction. Many devices exist, especially abroad. These machines apply stretching force using weights. Does it work? Well, a small study in translational andrology and urology showed that these extenders only help in Peyronie's disease. That's where fibrosis actually shortens the organ. For normal cases, they do not increase size. Penile clamps and rings, dangerous and useless. You may have heard of penile clamps and rings. These things have existed for over 100 years. They stretch and squeeze the organ. Here's the truth. They provide no real benefit. Worse, they can cause hematomas, that's blood pooling, and serious injuries. Please, do not use them. Oh, and many creams are also sold claiming enlargement. But guess what? No cream actually works. Not a single one. Penile vacuum pumps. Temporary at best. Next are penile vacuum pumps. These create negative pressure to cause an erection. They may temporarily make the organ look spongy and slightly increase girth. But here's the catch. They never increase length. Never. Penile enlargement injections. Know the risks. Now we come to something more serious. Penile enlargement injections. These have been around for over 100 years, believe it or not. There are many types. I'll explain which ones work and which don't. There are mainly 3 types used. Type 1. Autologous fat injection. Fat is taken from your body via liposuction and injected to increase girth. The problem? The fat gets absorbed over time, and if the injection is uneven, it can actually deform your organ. Type 2. Hyaluronic acid. This is a naturally occurring compound, but listen carefully, it must be injected very skillfully. If done improperly, it can cause deformity and fibrosis. When done correctly, it works and lasts longer than fat. Type 3. PMMA, polymethyl methacrylate, microspheres. These are tiny spheres injected into the organ. They can last for many years, but they must be injected properly. Now here's the big warning. All of these have side effects. If someone injects substances like silicone or synthetic materials incorrectly, it can cause gangrene. That means you'd need surgery that may completely destroy your organ. I'm not trying to scare you. I'm trying to educate you. Surgical options, the reality check. Now, the most important question. Are there surgical options? Here's what you need to know. Most healthcare providers do not recommend surgery because of the side effects. But let me explain the types of surgery that exist. Surgery 1. Free fat grafting. Fat is harvested, processed, and injected. But here's the problem. 20 to 80% of that fat gets absorbed within a year, so it's often temporary. Surgery 2. Dermal fat grafting. Instead of liquid fat, a fat layer is grafted around the organ. It improves circumference more than injections, but it still gets absorbed over time. Surgery 3. VY-plasty. This is a common surgery where the ligament attaching the organ to the pelvic bone is released. This makes the organ appear longer, but it mainly just changes the angle. It's not true lengthening. Surgery 4. Suprapubic liposuction. This involves removing fat above the pubic area, which makes the organ look larger. And here's an interesting fact. In 90% of people, the issue is psychological. Once it looks longer, they feel satisfied. Surgery 5. Sliding lengthening surgery. This is used only in Peyronie's disease, where actual shortening has occurred. It does not work for other people. Surgery 6. Penile disassembly. This is a very, very dangerous surgery. The organ is completely separated and reattached to increase length. This is highly invasive and is only done in cases like congenital micrognathia or post-cancer reconstruction, not for cosmetic reasons. Ever. Penile implants for dysfunction, not size. Next are penile implants. These are normally used for erectile dysfunction. They do not truly increase length, they only improve erection quality. Some FDA-approved implants can increase thickness slightly, but not length. The bottom line, what you really need to know. Let me summarize everything for you. Only 2 out of 10,000 men have a true microorganism. That's it. Many people have mental concerns about their size when there's actually no physical problem. Lifestyle changes, weight loss, reducing pubic fat, grooming and fitness, these help greatly. They really do. Alternative therapies, they help very little, if at all. Surgery, it's available, but only for specific medical indications. Not for cosmetic purposes in most cases. The internet is absolutely full of misleading information. Most people have completely normal organ sizes. Remember that patient I mentioned at the beginning? He didn't have a microorganism. He lost weight, improved his lifestyle, and we treated his erectile dysfunction, and now he's fine. He's happy. So please, take care of yourself. Stay healthy and stay happy. If you found this helpful, please like, share, and subscribe. Help other people be better informed and avoid harm. Thank you very much, and I'll see you in my next video. Dr. Conrad, Reproductive Medicine Specialist.